The COVID crisis in India is intensifying. At least 6 hospitals in the Indian capital, Delhi, have completely run out of oxygen. Other hospitals say they have just hours left of supplies. India has recorded nearly 315,000 new infections, a record number, the highest daily figure anywhere in the world since the start of the pandemic. Our South Asia correspondent, Rajini Vaidyanathan, reports.
The scale of India's loss is becoming hard to comprehend. Thousands dying every day. Each pyre a family in grief. And for some, it's turned to anger.
My father is not dead. He was cold-blooded murdered. Nobody has helped me. I called each and every hospital. I called all the oxygen supplier. Nobody helped me.
Harshit's father, Vinay Srivastava, was a freelance journalist. Like so many others in India, he'd made a desperate plea on social media to find a hospital bed. "I'm 65 years old. My oxygen levels have become 52. No hospital lab or doctors picking up the phone," he tweeted. A day later, his oxygen had dropped to 31. "When will someone help me?" he begged. The last photo he shared, his finger attached to an oximeter, showing a dangerously low reading. 5 hours later, he died. COVID-19 is crippling India's healthcare system. People are struggling to find ICU beds, and oxygen is in short supply.
We as a doctor, we as a hospital, we are supposed to give life. If we cannot give them oxygen even, what is the situation? When patient comes to, the patient will die.
In Delhi, dozens queued to buy oxygen canisters for their loved ones. Today, many hospitals in the capital were perilously close to running out. Shankar Baheti's family spent the day searching for oxygen for him. His niece told me relatives drove 5 hours to find supply for today. They'll have to do the same again tomorrow.
It's distressing. I can't imagine what his daughter, who's younger to me, my cousin, and his son, they must be going through right outside the hospital. They're stationed outside and running here and there at every lead to get to fill a cylinder or to get that oxygen.
A desperate second wave, which many health experts believe could be down to a new strain of the virus, one they fear is more infectious and deadlier. Rajini Vaidyanathan, BBC News.